Hello, my name is Erica, and today we're going to do a cranial nerve test. So we're going to test cranial nerves 2 through 12, and we're going to do 2, which is the optic, 3, oculomotor, 4, trochlear, 5, trigeminal, 6, abducent, 7, the facial, 8, vestibular cochlear, 9 is the nasopharyngeal, 10 the vagus, 11 accessory, and the 12 the hypoglossal nerves. So let's start first with the optic nerve. And this can be tested by using a Snellen chart. And what we would do is we would cover one eye and we would ask the patient to read the lowest line that they could see. And then we would cover the other eye and ask them to do the same thing, read the lowest line they could see. Then uncover both eyes, ask the patient to read both the lines, read whatever the lowest line that they could see. Now, while doing this, we want to make sure that they're not getting more than 3 letters wrong in the line. If they do, they'll have to move up and read the next line up. And then also we are checking at that point for each eye when they read it. We'll write if they have what type of vision they have. If it's 20/20, which is good vision. If it's 20/15 or 20/30, 20/10, that's really good. If it's like 20/25, that or 20/50, that would be like a poor eyesight. And so that's how we would check for the optic nerve. Now, next we'll check the nerve 3, and what I'm going to do is with both eyes open, I'll have the patient have their eyes fixed straight ahead, and with just my pen light, I'm going to move it in an H pattern and ask them to follow my pen light. And can you do that for me? Just with your eyes only, follow the pen light. Okay, great. So pass that test okay, and then next what I'm going to do is have him look straight ahead, and I'm going to check his for Perla, making sure that the pupils are reactive using the pen light here. So I'm going to come in from the outside, looking straight ahead. Okay, that's reactive. Okay, they're both reactive the same way, which is good. They're both reactive to light. Now we're going to check nerve 4, and also with using my pen light, I'm going to take it about 8 centimeters away and move it towards the tip of the nose. And the patient's eyes should go downward and in. So I'm going to hold the pen light 8 centimeters away, and his eyes did adjust, which is good. So that's he tested okay for that. Now for nerve 5, we're going to test his by placing my hand on his chin. I'm going to ask the patient to push against my hand. So he's going to meet some resistance here, and I'm going to ask him to open his mouth and try to push my hand away, which, okay, he did. That's no problem there. Now what I'm going to ask him to do is to close his eyes, and I'm going to place my thumbs here, and I'm going to ask him to try to open his eyes. All right, great. So I could feel that he was trying to open his eyes there with resistance. Now with the cotton ball, I'm going to touch his face, and I'm going to ask him to identify what part of his face that I'm touching. So
forehead, chin, nose, right cheek.
Okay, great. He was able to identify that, so he passed that test as well. Now we're going to check for nerve 6, and I'm going to ask him to follow my pen light, and we're gonna do a lateral movement here. And just moving only his eyes, not his head. 8 centimeters away, follow the tip of the pen. Okay, great. All right, he was able to do that as well. Now, we're going to check his facial nerves. I'm gonna ask the patient to act like he's chewing. Can you chew for me? Okay, great. He's got good facial movement. Now, I'm gonna ask him to repeat back a 2-syllable word for me. Basketball.
Basketball.
Okay, great. He was able to do that. Now I'm going to ask you to close your mouth and do a closed smile for me. Okay, symmetry is okay. And now I'm going to ask you to puff your cheeks like a puffer fish. All right, he was able to do that as well. During this test, we could also testing his nerve, test for using something sweet or salty as well. Now we're going to test nerve 8, which is the hearing. So what I'm going to do is cover up one ear and about 2 centimeters away. I'm going to whisper a word and see if the patient here can repeat it.
Basketball.
Oh, great. Okay, now I'm going to do this side. All right, we're going to cover this ear and repeat a word.
Basketball.
Okay, great. All right, the patient was able to repeat the word that I used, and I did whisper it. Now, his hearing is intact, which is good. Now, what we're going to do is also check, have the patient stand and check and make sure there's no swaying or anything like that. Like his balance is okay. Go ahead. All right, great. The patient is good there. We're going to ask him to sit back on the table. Awesome. All right, now what we're going to do is check nerve 9, and what I'm going to do is, let's see, I'm going to use my pen light here, and I'm going to have the patient say ah, and his uvula should move, like go up in the back of his throat. Say ah. Okay, great, awesome. Now, what we're going to do is check nerve 11. I'm going to place my shoulders on his, place my hands on his shoulders and ask him to push up so he'll have some resistance. So first, let me place my hands on your shoulders here firmly, and I'm going to execute. All right, no problem there, you see? And now for 12, I'm going to ask you to stick out your tongue. His tongue should go straight. There shouldn't be any deviation to either side. Now I'm going to ask him to move it right and left. Okay, he has no problem there. And that ends our assessment for today. Thank you.